How are you feeling with community? What are your feelings towards community? So tell me something. Community is very easy subject. Had to come. There are few, 3, 4 subjects which are going to irritate you, hurt you, depress you. Okay, they are to come. Community is far better. It's very easy if you read it proper. Let's check out last 5 years. 5 years, 5 into 50 or 5 into 75. So 50 to 75 questions, you check out what they are giving. So those 75 concepts only will be repeated with 1 or 2 bouncers. I'm not talking about bouncers. I'm just talking about what questions are going to be repeated. Like I have teaching something, the same slides, the questions have came. So it is your job, you go hit the right answer and come back. You should not get confused in something which is already known. I told you, right, it is 50, 70 concepts hardly. You list out all the concepts, 50 to 70. Revise them again and again. Make sure you are very strong in those concepts. For sure, 11 to 13 questions will be coming from this 50 to 75 topics, whatever we are discussing. So we have discussed fluorides. So now fluorides is considered as one topic. So you will have a question on fluorides. So that is what the question that is given, temperature-based question that is given. Previous year also you have a question on fluorides. Before that year also you have a question on fluorides. The same concept will be repeated. Yeah, bouncers will be there. 1 or 2 bouncers per each subject. So totally 20 subjects, 1 or 2 per each subject. So total in the exam you will be having 25 to 40 difficult questions. Those 40 difficult questions for different for me, different for you and different for you. It's not common for all of us. In that bouncers, some questions may be easy for you. The same questions will be difficult for your friend. So every one of us will have 20 to 40 difficult questions in the final exam. I'm not talking about those difficult questions. I'm talking about the easy 200, 190 to 200 easy questions will be there. So if you hit 160 or 170, 160, 165 odd in those 200 easy questions, I'm sacrificing 35 to 40 questions from that 200 odd also. And followed by you'll have 40 questions, even if you at least hit 10 or 15 out of 40 questions, tough questions, 10 at least. So 160 plus 10, 170 would be a decent score. Right? Whatever, whether you read or not, that is your wish. There will be a bunch of students who are going to get 175 plus in every exam, whether it is easy, difficult, very difficult. No one can answer, students will answer. Students will answer, pakka. Okay, right? So you read, you don't read, you take a break in the preparation, it's completely your wish. Because I have a great story in this room. A girl from Malareddy woman who sat here for 3 years only to grab a central government. She wanted a central government, that's all. She wanted a central government. She was here as an intern. Of course, internship, you know, things are not so comfortable. Then she sat again for 1 more year. She got A category in Telangana. She did not take. She said, I want a central government. Finally, she got a central government seat. Right now, doing prosto from pgimds Lucknow. Stipend 1,20,000. Telangana. There are people who has done it. Okay, right? I mean, it's about mindset. Okay, you see, different people are going to have different mindsets basing upon their comfort. Will you ask Ram Charan to prepare for an entrance exam? He will not prepare. Why he has to prepare? He will not prepare. His mindset is different. You see, any of these people, like you see Ram Charan is there, Allu Arjun is there, Rana is there. Have they studied well? They have not. Why? They have the privilege. Why they have to study? Why they have to study? We have to study. Because we don't have that comfort financially. To bring out that comfort, we have to study, that's all. The only weapon I have in my life is education. The only weapon. I don't have any other weapons. Similarly, most of us, we fall under the same tool where we need to study to get the financial stability. Of course, there are many other methods to get financial stability, but the only ethical method that we have is the dentistry. The education is the ethical method we have, so that the society is going to recognize our hard work at the end. Okay. So there are people, I have seen, there was one of my friend during my preparation phase. She was from Tamil Nadu. And like I'm not very serious into my preparation when I have initially started. I'm good at subject. Seriousness is different, good at subject is different. Even at UG level, I'm very good at subject. Okay, and no one appreciate me that okay, Srikanth is not hardworking. He's a smart working. He smart works. He manages the things. His presentation is good. He's more logical, sensible. Hard work is different. Being smart is different. Okay, right. So even during my preparation phase, yes, I score well. My scores are good. My approach is good. But I'm not such an individual who sit for lengthy hours. Now I'm sitting for lengthy hours. During my preparation, I never used to sit for lengthy hours. 2 or 3 hours, finish the content, again go back, take 1.5 hour break, again come back. This is my methodology. But there is one of my friend, she used to sit besides me, and she always used to read, break her head. By seeing her, I went into depression. By seeing her, I went into depression. Why? What if anything is going to happen to this girl? She's not sleeping. While she will go into mess also, she'll be carrying one sheet of notes, and she'll be eating, and she'll be solving something, she'll be reading something, having cup of tea, she'll be reading. I thought, mad, what is this woman doing? Why she's doing this? No, minimum rank that you are going to get is All India first. Even if you get 240 out of 240, you'll be getting All India first only. No point, right? I said, like, one day I was asked, I said, like, I wanted, why you do all this? Why you don't take a break? Why you don't go out? Why you don't watch a movie? Like, at least, like, we have a habit, like, long back. Now movie is different. Like, long back, the only stress breaker is watching a movie. Every 2 weeks we have to watch a movie. That's all. That's the only stress breaker we have. Now there are many stress breakers. I said, like, she was not answering me. I went off, and 2 or 3 days, after 2 or 3 days, she called me up again. And she told me her story. Okay, she has one brother and one sister, and her parents met with an accident. Both of them are no more, and she has to take the responsibility of her. She is from GDC Chennai, and then she worked for about 5 to 6 years. She is very elder to me. I'm a fresh intern. First, we started the preparation. She was very elder. She took 6 years break after finishing her internship, worked, saved money for preparation. We have privilege, right? Chelo, I want to repeat. Parents, they'll send the money. We have that privilege, right? She don't have that privilege. She worked for 6 years to save money to prepare for entrance exam. She has to come out, take a PG, stay in a city, has to prepare for entrance exam. We don't have online. Now you have online, right? 10 years back, we don't have any online institutes. Okay, right? So she worked 5 years to prepare for entrance exam. So it's a dedication of 5 years. So her category of preparation is different. If she failed in this exam, again, what she has to do? She has to go back, join as a BDS staff, get the 20 odd salary, with which she has to manage his brother, sister's education, and she has to take care of herself, which is impossible. Okay, so she said, like, bro, it's very simple. I have 6 months of preparation time, for which I have worked for 6 years. If I fail in this by mistake, if I fail in this, I need to go back to the same pool where I have started my journey. If I succeed, if I get a rank through this preparation phase, and the only option I have is government dental college. I don't have parents having that privilege to pay an A category seat or a deemed college seat or a management quota seat for me. So the only option is, if I get a GDC, I will be successful. I can take care of my brother and sister, their education, and maybe I may be successful in my career, or personally I may be successful. So if I fail, I'll go back to again the regular thing. So that is the reason why I'm more serious about my goals, because I don't have any plan B. Like, we have a plan B, right? What is the plan B? If not this, okay, everyone starts the preparation with aiming for government dental college. If we miss GDC, what is the next option we have? We have a private college seat. If not, we have a B category seat. If not, we have a C category seat. If not, we have a privilege of repeating the exam. If not, we can do something XYZ. So for this girl, there is no plan B. There is only one plan, that is to grab a GDC. And she is not great or extraordinary. I'm openly telling her. We used to discuss the concepts, and she's very, very poor in the concepts. Very poor. Trust me, she's very, very poor. Okay. So what happens on the day of result? She got a rank. She secured a rank. Okay, right? And she has done GDC, same college, GDC Chennai, Prosto she has done. Now she is having a good life. And recently she got married also. She's having a very good. So we see like people with a different mindset. Like most of us, we sit together, we read together, but the stories are not same. Okay, few of you have approached here with a different goal. Few of you have a privilege. Directly on the day one, sir, I just want to qualify. Day one only, your target is to just to qualify. So everyone in this room are not with the same goals. Okay, like you are successful, your story is going to be different, my story is going to be different, your story is going to be different. Okay, right? You got it right? Okay. So the suggestion from my side is, whatever you want, whatever you have, for a reason you have entered this room, okay, you try to give 100% first of all. Leave about the result. Right? We are not talking about the result. Result will be probably after 10 months from now. Leave about the result. What you are giving in this 10 months is more important. Result, yeah, if you are 100% with your efforts, result will definitely come on a positive side. Okay, right? So I want you to increase your energy levels. Okay, so it is already 1 month we have started the offline first class. Okay, right? So we are done with 2 minor subjects, and now we are about to finish the 3rd major subject. So I want you to speed up the things, increase the number of hours that you are going to prepare with the book. That is more important. Like I'm talking to few of you, your timetables are so bad, so horrible. Even not, you see, Pratisha ma'am is dedicating every day this much of time for you or for MDS CONQUER. I am also in my daily routine, I am also dedicating some time for MDS CONQUER. Karan sir is also dedicating a part of his time for MDS CONQUER, right? So when you are preparing for entrance, how much you dedicate? It should be more than us or it should be less than us? More or less? I don't say, I was talking to a few of them, 6 hours, 4 hours, if I have mood, 6 hours, if I don't have mood, 4 hours. What is this? This is, you are preparing for something which is going to change your life completely. Trust me, it's going to change your life. Department is going to change your life. College is going to change your life. City where you are going to do PG is going to change your life completely. Your orientation, your lifestyle, everything is going to change. So that important part you are in. And we know that most of us are not extraordinary during our UG, right? Even if you are extraordinary, your college is not extraordinary. Right? We are not from extraordinary colleges. There are very few extraordinary colleges in the dentistry who think about student. Hardly less than 10. Only less than 10 in the entire country, less than 10 colleges are there. Most of the colleges, they don't think about the student. Least bothered about student. So we are coming from such a background, so our mindset will also be like that. So I just want you to upgrade your mindset. Okay, because mindset upgrading is very, very important. And no one is reading in my college, why I should read? For whom you are reading? You are reading for college. You are reading for your friend. Now this is the common answer I regularly hear from the students. Sir, no one is reading, sir. So I also have, first month I was reading, then why you stopped? As no one is reading, I stopped reading. Who is at loss? You are at loss. Okay, right? So at least now I want you to gear up, speed up the things, take things very seriously. You take this 1 year seriously. If you take this 10 months seriously, most of the things professionally will fall in a nice track. Definitely. Okay. Then that is your wish. Whether you enter into PG, you want to learn something or just want to have a tag and come back, that is your wish. You take your decision after entering into the PG. But this particular phase is very, very important. And on the other side, I'm telling clearly, they were my friends, they were students who don't break their heads for preparation. Cool, composed, settled, nice mindset. I never see such people like working so hard, breaking their heads. But you see the rank list, their names will be there in the rank list. Such an approach is also acceptable, but you have to fall under that particular criteria. Okay, you fall under that particular criteria on the day of result, you're very sure your name will be there on the list. Yeah, it's okay. That's what I'm telling. Like I'm such an individual. I don't do this night outs and all these stories, having tea, reading in the mess, reading in the movie theater in the interval. I don't follow this nonsense. Okay, I see people, they used to carry something in the interval, going for a movie. In the interval, they're reading. Sounds a bit odd. But again, on the other hand, I have seen like Malareddy Coed Shweta, who is the best ranker from Telangana till the date, all India 8th rank. Most of her preparation was in college bus. Most of her preparation, because she cracked the entrance, grabbing 8th rank in the country, being an intern. She told on the day of interview, sir, most of my preparation, I used to come from 5 kilometers from LP Nagar is my home. So I need to travel every day at least 3 hours on my college bus. So most of my preparation was within the college bus. Like, that's what, like, being an intern, yeah, it is okay, accepted. So my suggestion for all of you who are traveling and coming here, yeah, maybe while you're traveling on metro, while you're traveling on a bus, yeah, you can scroll something which may be effective or which may be useful for your revision. Okay, right? Clear? So energy is important in the preparation. Okay, I'm not telling that you guys are dull, but preparation always requires high energy levels, right? You need to maintain that energy levels in the preparation, which are at most important. Exchange of energy is important. So being positive to your co-aspirant is very, very important. Like, all of you who are sitting in the cubicles or who are sitting here, please do maintain the tempo, friendly relationship for the next 10 months. Further, you want to continue this or not, that is completely your wish, because I have seen many students who become great friends. There were people who got married also in the same room. Okay, there are 3 or 4 couples who got married. Yeah, I'm very happy for them. Okay, so please do maintain at least, I mean, not lifelong commitments. What I'm telling is, I just want you to at least maintain the tempo of these 10 months. Fighting for chairs, fighting for places, please. We are professionals, right? We are dentists, we are doctors. Okay, we should have that ethics and everything. One chapter is there, ethics in dentistry. Go back, open, Shoban better first read that. Right? So please do maintain that nice tempo, good environment around you, because this good environment will give you a good rank. Okay, right? Yeah. Chalo, let's start. So I think we are done with 117. Right? 117. 118. So 118 is the question from your dentist. So please write down in the bracket dentist. I have already discussed about caries vaccines in the last class. So the predominant immunoglobulin that is present in saliva is IgA. IgA, of course, GAM, all are present, but predominant is A. The second predominant is G and third predominant is M. Okay, right? So your caries vaccines are regularly prepared from IgA immunoglobulin. Of course, there were few studies where they have prepared the vaccine from IgG also, but the better answer is IgA. Similarly, one more important line about IgA. IgA is, so you have something called as Down syndrome, right? Down syndrome patient is going to have less incidence of dental caries. Caries is very, very less in Down's patient. The reason why caries is very, very less in the Down's patient is because of the presence of high IgA immunoglobulins. IgA immunoglobulins compared to you, Down's patient is going to have more IgA, because IgA immunoglobulin is one of the immunoglobulin which is going to fight against caries. So that is the reason why Down's patient is going to have low incidence of dental caries. Low incidence of dental caries in Down's patient is basically due to presence of more IgA immunoglobulins in the saliva. And IgA immunoglobulin is present as a dimer. Dimer means 2 subunits, 2 single units attached together is a dimer. Okay, right? So to attach these 2 single units, of a dimer, you require something to hold them together. So that is the holding thing is called as chain, J chain. Similarly, IgM you have. IgM, I told you right, IgM is the strongest immunoglobulin, is the coolest immunoglobulin, is the immunoglobulin with larger molecular size. Okay, right? Right. So IgM is also present as a multi-unit. How many units will be there? 5 units will be there. Okay. So 5 units. Whenever you have more than 1 unit, you require a chain to hold it. So the chain is called as J chain. So J chain is present in which of the following immunoglobulins? IgA and IgM. 2019 NEET question. J chain is present in M and A. Immunoglobulins which have more than 1 unit in their structure, M and A. Whenever you have more than 1 unit, you require something to hold. That something is called as a chain. That chain is called as J chain. And we have already discussed about caries vaccines. Okay, right? I told you the major disadvantage of a caries vaccine is, yes. So caries vaccines, whenever they are generating, the antibody which is being secreted is reacting with antigens which are present in the heart, which is causing the more damage. It is destroying the heart tissue. So that is the reason why the production of these vaccines was halted, stopped. Okay, right. So if you check out 118, this is the question from your dentist. There is a little bit of controversy in this question. So option A is monoclonal antibodies are formed which attaches to the tooth surface by adhering to the salivary pellicle. That is right. And these monoclonal antibodies are called as murine monoclonal antibodies. Please write down their murine monoclonal antibodies. Write down option A in the bracket. It is murine based. It is a murine based monoclonal antibodies. Coming to option B, Streptococcus mittens bind to antibodies. That is the basic whatever you are. But major disadvantage of this is it is reacting with the heart tissue. So write down the disadvantage of streptococcal antibodies is it is reacting with heart tissue, damaging the heart tissue. Yes, option B is also a type of caries vaccine. Coming to option C, new flora is established. Okay, it's not new flora. Basically what they have done is they have done some mutation in Streptococcus mittens. So normally Streptococcus mittens, what it is doing, Streptococcus mittens is acting on sucrose and resulting in production of lactic acid, which is causing dental caries. Okay, right? But what they have done, they have modified. So they have modified the Streptococcus mittens. So the mutation of Streptococcus mittens was generated. But this mutation of Streptococcus mittens is not able to produce that lactic acid. Okay, so they are replaced the normal Streptococcus mittens by this mutation in one of the study. Okay, so write down in the bracket option C. You have previous? You have to take it. Right, Nanda. Who is not having the last week? There are some of them who has absent for the last week. Okay, right. So option C is new flora is established. It is not exactly new flora. Okay, it is basically the mutation one. Okay, so please write down. So there is a mutation strain in Streptococcus mittens, which does not have the capability of secreting that lactic acid, by which they are not causing dental caries. Coming to option D, Streptococcus fecalis takes the place occupied by Streptococcus mittens. It is basically E. fecalis. Long back, E. fecalis, we have already discussed, right? E. fecalis, which is mainly responsible for root canal failure. So long back, the old name of E. fecalis is Streptococcus fecalis. Okay, right? Both C and D are wrong. Both are wrong. Okay. But I mean, like we can incline to option D when compared to that of the C, considering the new flora is nothing but mutation. New flora is considering that mutation. The answer in dentist was given wrong. Okay, right? People who are solving dentist, the answer was given wrong. Both C and D are wrong, but more wrong is option D. Because your E. fecalis or Streptococcus fecalis is nowhere related to dental caries. It is present within the root canal system of a failed RCs. Next. 119, the main site of absorption of ingested fluorides is stomach and small intestine. Recommended average daily intake of fluoride from all the sources combined for adult and child is. Adult is more and child will be less. That is the first logic. Whenever you have a question like this, the first logic is common sense is adult will have more. So first you try to implement that option by which at least you will be eliminating one or two options. So exact answer is 0.2 to 2.2 milligrams for adult and 1.2 milligrams for child. Right. The next one is the minimum concentration of fluoride required to the inhibition of enzymatic action of bacteria is 50 ppm. What is that enzyme name? Enolase. Enolase enzyme. We'll be discussing in biochemistry about enolase enzyme. Okay, right. How it's going to inhibit the enolase enzyme? Yes, because the cofactor which is required for the activity of enolase enzyme is presence of magnesium ion. So you add fluoride, what it's going to do? It's going to react with magnesium to form magnesium fluoride, by which it decreases the magnesium availability so that the reaction will not proceed. That is how it is being inhibiting the enolase enzyme. Okay. 50 ppm. Okay. So we know that community water fluoridation, the fluoride concentration is 0.5 to 1 ppm, right? This is a new WHO guidelines. 0.5 to 1 ppm is the fluoride concentration in the case of your community water fluoridation. Coming to school water fluoridation. School water fluoridation, the recent recommended is 4.5 to 6.3 ppm. The recent recommended, this is old one. We don't want old one. The recent one is 4.5 to 6.3 ppm of fluoride is required in school water fluoridation. The reason is children are going to stay only a part of their time within the school. So that is the reason why I'm giving a higher dosage of fluoride than community water fluoridation. That is 4.5 to 6.3 ppm. And even this question was asked, how much amount of caries reduction was found by school water fluoridation? The answer is 45 to 50% reduction is there. Now, of course, this is the question of a common question that is repeated. So this was given in 2023 NEET examination. Okay, and I want you to follow this particular table. There are 2 or 3 different reference-based tables, but I want you to straight away follow whatever that is given in your Chauvin pattern. So this is a table which is given in Chauvin pattern. Whatever I have discussed in the smart video is given in the Chauvin pattern. So I clearly told you, whenever the baby age is less than 6 months, the first teeth that is erupting into the oral cavity is primary mandibular incisors, which are going to come at the age of 6 months. So till 6 months, I don't require any fluoride. Okay, right? So till 6 months means from birth to 6 months, whatever may be the amount of fluoride that is present in the drinking water, I don't want anything. So not recommended. So 0 to 6 months not recommended. And we have discussed, according to WHO, the range is 0.5 to 1 ppm. This is the thing which is sufficient for me to prevent the dental caries. So whenever the ppm of fluoride which is present in the drinking water is more than 0.7, 0.7, yeah, that is the normal value, right? I'm already getting it. Whatever may be the age of the kid, whenever your water is having more than 0.7 ppm of fluoride, I don't require anything. Clear? So all these are done. So the leftover are 6 months to 3 years, 3 years to 6 months, and more than 6 years, right? 6 months to 3 years, 3 years to 6 years, and more than 6 years. Okay, right? So this is simply crisscross. Okay, so you need to work on, you need to practice it so that you will be coming with the right answer. Okay, so once you practice 2 or 3 times, it will be registered in your mind so that you can come out with the answer. Okay, right. So now you have a question. The question is, the fluoride supplements you would recommend for a 4-year-old child living in an area without any water fluoridation. Without any water fluoridation, a 4 years kid is going to have without any water fluoridation. So it is going to come here, right? So 3 to 4 years without any water fluoridation means less than 0.3 ppm. So the answer is 0.5 milligrams per day. It's a range basically, okay? It's a range basically. It is 0.5 milligrams per day. So next one is, so these are toxicity related stuff. Again, straight away lines from your Shobhan pattern. So this is already there in your power play books. You can open your power play books, already discussed in your WhatsApp activity. So first one is acute. So acute is, you're going to have 35 to 70 milligrams of fluoride per kg body weight, or 5 to 10 grams of NAF for a patient who is 70 kgs. Okay, so that is going to be a toxic doses. And all these terms are very, very important. Minimum toxic doses, probable toxic doses, safety tolerable doses, critical lethal doses, and all these values are important, which are already given in your power play. Straight away, they are going to use the common term. Again, in the last 5 years, once the question was repeated from the same area. So they're going to ask you what is safety tolerable doses, what is the value they're going to ask you. So you need to go for the answer. So 122, fluoride safety doses is 8 to 16 milligrams of fluoride per kg body weight. Again, we have discussed, right? So Nalgonda technique of defluoridation technique of Nalgonda was done at which place? It is done in Nagpur, right? It is Nagpur, and the institute which has done it this is NEET. That is your National Environmental Engineering Research Institute. So it was done in the Nagpur, and it was after the studies, it was implemented in the Nalgonda. Okay, so what are the indications for Nalgonda defluoridation technique? So what are the indications? Absence of acceptable or alternative low fluoride water source within the transportable distance. If the water without fluoride is not available within the reachable area, then what you have? You have to go for defluoridation. That is one very important indication. The second one is the total solids, dissolved solids should always be less than 1500 milligrams per liter. It should always be less than 1500 milligrams. Whenever it is more than 1500 milligrams per liter, you have to go for desalination first, okay, to remove that solids, dissolved solids. Then after you have to go for defluoridation. The minimum value is 1500 milligrams per liter. Next one, the raw water fluoride should ranges from 1.5 to 20 milligrams of fluoride per liter. So fluoride should be within this range. So then only this technique can be implemented. So these are the 3 important indications for Nalgonda defluoridation technique. Okay, so that is your question number 123. The answer is all of the above. Okay, so I have given all the values. So make sure, please do mark that particular question. Okay, so all the lines has to be revised. Next one, 124, the threshold doses of fluoride that requires immediate emergency treatment and hospitalization in acute fluoride toxicity is 5 milligrams. Again, statement is important. 1 ppm of fluoride, let it be anything, 1 ppm of fluoride is also, the answer is same. That is 1 milligram of fluoride present in 1 liter. Or if they are talking about weight, that is 1 milligram of fluoride that is present in 1 kilogram. So I'll ask you, how many milligrams of fluoride are present in 100 ppm? 100 milligrams. Now I'll ask, 100 milligrams are present in 1 kg. Now I'll be asking, how many milligrams are present in 100 grams? I hope you know that calculations, right? So those calculations are very frequently asked in the exam. Okay. So for example, So they are going to tell you how much ppm is present. Now they are going to ask you how much amount of fluoride is present in 1 ml. Because 1 ppm is nothing but 1 milligram of fluoride that is present in 1 liter. Now I am asking in how much it is present in 1 ml. So I need to divide that particular value by 1000. Be clear with these calculations. And similar calculations we are going to deal again in your local anesthesia also. The same calculations we are going to do. So very, very important. So 125, 1 part per millions of fluoride is nothing but 1 milligram in 1 liter of water. (126) according to WHO, minimum amount of fluoride that should be present in the salt for effective anti-caries activity is 1.5 milligram of fluoride for 5 grams of salt. Already discussed in your WhatsApp activity. Again, this is again from your power play books, already discussed in your WhatsApp activity. So 2% of NAF is going to be 9000 ppm. Okay, and 0.2 means by 10. So I am dividing 9000 by 10. So the value is 900 ppm. So that is going to be, I am going to give it weekly. Okay, so now it is 0.05 ppm. 0.05 is nothing but I am dividing it by 4. So now I am going to divide it by 4. The answer is 225 ppm daily. So daily is 225 ppm. Weekly is 900 ppm. Okay. So question is 127. Please do mark it. 0.2 NAF mouthwash is recommended weekly. How much amount of ppm it is going to have? 900 ppm. Again, all these are discussed in your activity. Pastes, fluoride pastes are contraindicated below 4 years of age. Fluoride mouthwashes are contraindicated below 6 years of age. Tablets we are going to give regularly after 1 or 1.5 year. Few references are telling it as 1. Few references are telling it as 1.5 year. Okay, right? So 128 according to WHO, fluoride mouthwash rinse is not recommended under 6 years. 129, age group in which NAF is applied in Knudsen's technique is 3, 7, 11, 13. Chalking off. Yes, it is basically due to sodium fluoride, NAF. For example, the same question is asked, due to the formation of which of the following? Due to the formation of which of the following, your answer is calcium fluoride, CF. 131, mechanism of action of APF gel is via the following reaction product is DCPD, that is your dicalcium phosphide dihydrate plus calcium fluoride plus fluorapatite. Ceramic restorations, which of the following is used? 2% of NAF is used. Which of the following is applied once and left dried? Most of them, okay. Most of them we are going to do the same, but here the preferable option is SNF2, so that we regularly call it as paint on technique. So it is called as paint on technique. So once we paint, we have to wait for 4 minutes of time. Again, that is a question which is commonly asked. We have to wait for how much time? 4 minutes of time for it to dry. Percentage of NAF in APF solutions. If the question is percentage of APF, your answer is 1.23%. But now the question is not the percentage of APF. They are asking the percentage of NAF in APF, because to prepare APF, we require NAF. We are going to start our reaction with NAF. So we normally require 2% of NAF for preparing 1.23% of APF. I hope this is very, very clear. So APF is prepared from NAF. Okay. So normally APF, the percentage is 1.23. To prepare 1.23% of APF, we start our reaction with 2% of NAF. So the question is indirect question, so please do mark it. The percentage of NAF in APF solution is 2%. Again, 8% of SNF2 contain how much percentage of fluoride in it? 2%. Fluoride form that has to be freshly prepared before its usage is SNF2. SNF2 does not have storage time. How much amount of fluoride that is present in APF gel? Now the answer is 1.23%. Thixotropic fluorides gels enhances the potential effect of tropical fluoride because of easy flowable into the interproximal spaces. Maximum benefits are obtained if the teeth treated with tropical fluoride for a minimum period of 4 minutes. Okay, so now let's look into the 3 fluoride varnish. Okay, so 3 important fluoride varnishes are there where most of your questions will be moving around, and I hope 2 of these most of us are familiar. So what is going to happen is, so with all the currently used tropical fluorides, okay, about 2/3 of the fluoride acquired after the treatment is lost within days. Means whatever you're going to inject into the teeth in the form of fluoride, most of them will be lost in the first couple of days itself. So that is the reason why we apply it on a multiple times to the patient. Okay, so increasing the time of contact of the fluoride between the enamel surface and the tropical fluoride gel favors the deposition permanently, and we have already discussed about how the fluoride is going to react with the hydroxyapatite. So that is forming fluorapatite and fluorohydroxyapatite, which are more resistant to dental caries. And the first one is, you guys are familiar. So what is the ppm of this? ppm of this is 22,600 ppm, a very commonly asked question. And this is the first fluoride varnish. Okay, this is the first fluoride varnish. So this ppm is a very frequently asked question, and it's going to contain sodium fluoride in a neutral base. Okay, in a neutral base, and the fluoride concentration is 2.26%. This is also a question which is repeated. So the amount of fluoride which is present in 22,600 ppm is 2.26%. So next, second one is fluoroprotector. What is the ppm of this? ppm of this is 7,000 ppm. 7,000 ppm means what is the percentage of fluoride? 0.7% of fluoride will be present. Right. The third one is Carex. So this is another fluoride varnish, but it's going to contain low fluoride concentration. Okay, how much the fluoride concentration it is? 1.8%. But the advantage is it is equally efficient. Concentration of fluoride is less, but the efficiency wise it is equally efficient. So here most commonly asked questions are ppms. Okay, so ppms they are going to ask you. (140) the answer is A. 141. B. 0.005, that is 225 ppm, which we are going to give on a daily wise. If it is weekly wise, 0.2% is 900 ppm. Okay. Which of the following is going to have greatest fluoride concentration? Fluoride varnish. 22,600 is one, 7,000 is one, and 18,000 is the last one. Carex is 18,000. Main disadvantage of cavity varnishes. It is basically not within the cavity. like wherever you apply, you have to restrict the diet for a couple of days. Okay, because the options, you check out the options, the main disadvantage of cavity varnish, where I am going to apply cavity varnish, what we have discussed in our operative dentistry. Which restoration we are going to apply varnish. Only one restoration we are going to apply varnish is amalgam, but you don't have any options related to amalgam here. Okay, right? So considering that, they are talking about varnish which is applied as a topical applicant. Okay, so for that there is diet restriction. Okay, so you should not eat, you should not drink anything for first 1 hour, and for the first 1 day you need to go for semi-solid food. You should not go for a solid food. Okay, right? So keeping that, there is a restriction of diet after the application of varnish, topical fluoride varnish onto the tooth surface. Next one, 144, please do mark it. The maximum fluoride content in a dentifrice in a patient with high caries should be dash ppm 1500. 145, the best method to prevent initiation of caries in a 4-year-old who has no access to community water fluoridation is? Yes, because for a 4-year kid, toothpaste, mouthwashes contraindicated. With simple brushing technique and flossing, you cannot give that source of fluoride. So the answer is 2% of NAF tablets daily. 1.6, 146. One tablet of 1.1 milligram of NAF contain how many milligrams of active fluoride? First simple logic here in the question is, tablet is how much, the weight of the tablet is how much? 1.1. The fluoride in the tablet will be more than the weight of the tablet or less than the weight of the tablet? Yes. Check out the options. 0.5 milligrams of active fluoride. Okay, right? Sometimes what you have to implement is the common sense, which has to be implemented more in the exam. Okay, so because everything we cannot read. We can give from any textbook. There are 100 number of textbooks available in the source. Now you have internet, right? Now the 100 has become 1000. Okay, so first of all, you try to apply the common sense for any question. 147. Purpose of fluoride prophylaxis after oral prophylactic procedure is mainly due to, because we have already discussed, maximum amount of fluoride is present in the outer surface of enamel compared to the inner surface. So outer surface is going to absorb more fluoride and it's going to have more fluoride in it. Okay. So what I am doing is, during prophylaxis, I am doing some micro scratches on the enamel. I am doing it, which are being reduced with the help of prophylactic paste. I am going to use polishing paste by which the scratches will be reduced. In this process, what I am doing, the surface enamel, whatever that is there, I am removing it. Okay, right? So now it's better you do prophylaxis with fluoride, so all the enamel will be replaced. So all the fluoride in the enamel will be replaced. So replacing the fluoride lost during oral prophylaxis, option A. Okay. 148. Crippling fluorosis is characteristic by rigid spine. The spine become rigid. So all these patients, so this crippling fluorosis is basically chronic fluorosis. Acute fluorosis means the signs and symptoms will be immediate. Okay, let it be, it is basing upon the doses. We'll be discussing that when it is going to be acute. Acute means suddenly you are taking high amount of fluoride. Like for example, child, whenever the child is there is sometimes you give access to the toothpaste and everything, fluoride toothpaste is there. The child is eating that fluoride toothpaste a larger doses, that leads to acute reactions. Or you have a question in your 2025 NEET examination. What is the question that is given? Ceramic. Your chairside assistant or someone is in a lab, they're dealing with ceramics and they're etching the ceramic. Ceramic is basically etched with the help of 9.6% of hydrofluoric acid. So whenever, if this hydrofluoric acid come in contact with us to the skin, or whenever, like for example, someone want to do a suicide in the clinic, nice acid is available, chalo, I'll go and drink that acid. Okay, so what is going to happen? This hydrofluoric acid will come into the body which is going to irritate, and this is called as acute. Daily wise you are taking fluoride, so that is called as chronic. So crippling fluorosis is basically the spine become rigid, not only spine, the joints, everything in the body becomes stiff. Okay, so that is called as crippling fluorosis, which is a chronic fluorosis. Next one, 149. Fluoride is maximum in which of the following hard structure? Cementum, that is 4500 ppm. I told you why it is maximum. Whenever something is porous, fluoride will go there. Okay, so compared to all the structures, we see cementum is more porous, it absorbs more fluoride, that is 4500 ppm. So 150, fluoride in any form is contraindicated in chronic renal failure. (151) Colorado stains or it is also called as molten enamel is given by Mackey. Is given by Mackey in the year 1901. 1901. Bauxite was identified by Churchill in the year 1931. Shoe leather survey was given by Dean, 1931. Dean's fluorosis was given by, very simple question, genuine question. Dean's fluorosis was given by Dean, 1934. First water fluoridation was done at Grand Rapids, 1945. Grand Rapids, 1945, very frequently asked question. 156, most commonly used component in fluoride dentifrice is sodium monofluorophosphate. A similar question, 157, already discussed. This is a similar question which is given in a recent exam. So what is the most important? Temperature. Temperature in Fahrenheit. The mean maximum daily air temperature in Fahrenheit. Okay, right? So we have discussed in the class. Okay, so apart from crippling fluorosis, there is something called as knock knees. Okay, and we have bow legs also that we regularly see in which vitamin deficiency. Legs will be bowed in which vitamin deficiency? Vitamin D. What is the disease called as? Rickets. So what is the difference between the knock knees and bow legs which are seen in the rickets is? What is the difference? The alignment is different. Okay. So in knock knees, okay, the alignment is outside. So you'll be having bending outside. Whereas in the case of rickets, you'll be having bending inside. Okay, right? So that is very, very important. Outward bending of hands and legs are seen in the case of chronic fluorosis, which is called as knock knees. Whereas inward bending is seen in the case of rickets. Okay, so they can give a diagram based question. Both look same. But what you have to do, you have to draw an alignment. So if the alignment is inside, then it is rickets. If the alignment is moving outside, then it is called as fluorosis knock knees. Okay, right? So outward bending of hands and legs are seen in the case of knock knee, which is one of the common thing that we see in the case of your severe skeletal fluorosis. So these are other things that they can give us. Okay, right? So what are the things? So whenever the patient is having a chronic, I'm not talking about acute. Acute toxicity will lead to nausea, vomiting, and it will have some effect on the cardiac system. Your heart rates and everything will be modified. So acute thing requires acute treatments, immediate treatments. Okay, some treatments are simply you're going to give some milk to the patient, create some nausea and vomiting. Okay, if the doses are very, very less. In some high doses cases, what I'm going to do is I'm going to give the same component which I have given for hydrofluoric acid. That is a question given in your calcium gluconate I'm going to give to the patient. Okay, and I'm going to do gastric lavage. I'm going to give calcium gluconate, and I'm going to monitor the cardiac vitals and everything, I'm going to do this. Whenever it is coming to the chronic is daily you're getting more than the doses that is required for fluorides. In such conditions, they can give this systemic symptoms in the patient. Okay, so that is clicking and cracking sounds, slow onset of symptoms, because it's mostly causing effect on the bones. The patient is going to have lower back pain, and I told you the patient is going to have stiffness, right? So stiffness, reduced flexibility, and it is the patient feels very, very difficult to bend. Flexibility will be lost. Stiff bones will be there, stiffness will be there, pains in the joints, particularly knees, hips, hands. There will be lots of pains in the joints. And of course, psychological disturbances like disturbed sleep, fatigue, depression, and mood swings will be there. So mostly, like whenever they're giving a chronic fluoride patient, they can include all these signs and symptoms in the description part, and they'll ask you what to be done for this particular individual. Now, I told you, right, I told you acute. So management of acute fluoride toxicity. So whenever the value is less than 5 milligrams per kg body weight, so I'm just going to induce vomiting, okay? So, or I'm going to give calcium orally. That can be in the form of milk or something. Why? Because whenever calcium has fluoride, it's going to react to form CF. That is what we have discussed in NAF2 also. Whenever you are applying calcium on the fluoride, it's going to react and form calcium fluoride, by which it is decreasing the availability of fluoride in the GIT. Okay. So whenever it is less, that is 5 milligrams per kg body weight, I'm going to do this. Whenever it is more than 5 milligrams per kg body weight and less than 15 milligrams per kg body weight, I'm going to empty the stomach by vomiting, or I'm going to do a gastric lavage. I'm going to clean the stomach, and I'm going to give orally soluble calcium. I'm going to give in the form of anything like milk, or 5% of calcium gluconate I'm going to give, or calcium lactate, anything. Calcium I'm going to feed with the patient because calcium reacts with the fluoride. And I'll be asking the patient, administration in the hospital and everything. The most important thing is whenever it is more than 15 milligrams per kg body weight, hospital immediately, induce vomiting. I'm going to monitor all my cardiac vitals of the patient. I'm going to give 10 ml of 10% of calcium gluconate. So, of course, this calcium gluconate is again used in your hydrofluoric acid accidents also in your dental lab. Okay, whenever your hydrofluoric acid come in contact with the skin, if you're not wearing glove and you're trying to itch your ceramics are basically itch with the help of 9.6% of HF. So whenever this hydrofluoric acid come in contact with your skin, immediately you have to wash it, and then immediately you have to place this 10% of calcium gluconate. The same question was given in NEET 2025. Of course, it's a straight away line from your dental Phillips textbook. Straight away line from your dental Phillips textbook. Again, whenever you drink fluoride, what is going to happen to the fluoride? Fluoride will start move to the body. So once it hits the stomach is going to have lots of hydrogen in it. So this fluoride is going to react with hydrogen in the stomach to form hydrofluoric acid. So hydrofluoric acid is very, very irritant to GIT. That is the reason why the patient itself is going to have nausea and vomiting. So to neutralize this hydrofluoric acid which is present in GIT, I am going to give calcium gluconate. Okay, right? So apart from this, there will be electrolytic imbalance that can occur. Okay, so what I'm going to do is I'm going to give this extra electrolytes, whatever that is present. I'm going to monitor the urine. I'm going to give support to the shock.